Hi, I'm Dr. Melissa Hakim, your health advocate, and welcome to my views from the deck. Same deck, different views. Today, let's focus on COVID-19 and testing. Testing is in the news, and I just want to give you the basics so you understand the different type of tests that are out there. First, let's look at tests that are done to see whether or not you have active COVID-19 infection. You have to give a sample, throat swab, nose swab, they're even looking at saliva. There's two different ways they could do it. One is called molecular testing, where they'd see if you have genetic material of the virus. This has a longer turnaround than something called antigen testing. The antigen testing is a newer way of testing. It's rapid, and it looks for the virus proteins. The problem with the antigen testing is it has a higher false negative. What does false negative mean? It means if this test result comes back positive, you have COVID-19. But if it's negative, there's still a chance you might have the infection. So some places are actually then sending off their negative test results to get the molecular testing to see whether or not you actually are infected with COVID-19. The second type of testing is called antibody testing, and that's to see if you had the infection in the past. Antibodies are proteins that are formed in the body when you're exposed to a germ. They take time to build up, anywhere from 1 to 3 weeks. So you can't get antibody testing until you have recovered from the virus. It is a blood test. The problem with antibody testing, it can have false positives. What does that mean? Well, it means if your antibody comes back negative, you didn't have COVID-19. But if it's positive, there's a chance that it might be measuring a different antibody than the COVID-19. When we talk about testing, we think about sensitivity and specificity. Sensitivity is you want the test to be sensitive enough to pick up the antibodies, but specific enough that the antibodies picked up are COVID-19. And all these tests have different accuracies. I recommend you talking to your doctor about the best place to go to get tested. If you have symptoms, call your doctor first and they will give you directions on where to go. If you're confused by your health at this point and would like an advocate on your side, please don't hesitate to reach out to me, Dr. Melissa Hakim, your health advocate. And until next time, be well, be safe, wash your hands, physical distancing, take care.